just want to go on to the next question, which is about vaccine distribution. As you well know, you've been getting this going on in the House of Commons now for quite a bit. And it is a very difficult and complex issue, and a lot of people don't understand that. And so I have a question, and there are 1, 2, 3, 4 people that I kind of pulled together because the questions are basically about vaccines. And Shaena from Richmond's Chamber of Commerce says, when vaccines are available, how should we expect distribution to be allocated? Furthermore, will there be a passport or other system to denote who has already been vaccinated? Anthony from Vancouver said, since health is largely handled by the provinces, what have been some of your biggest challenges when coordinating with all of your provincial counterparts during the pandemic to get vaccines? Vidhi from Vancouver said, what are your plans for introducing the COVID-19 to Canadians? How can the federal government play a more active role in funding scientific research based on physical and mental health comorbidities? And Debbie from St. Paul's Advocacy said, how will the vaccine be distributed after essential services, seniors in care facilities? What about those persons with disabilities and seniors living in subsidized housing? How are we going to get at those people? So as you can see, a lot of it is about vaccine distribution, a lot of it about how we plan to do it. And some people have already recognized that this is province are going to have to distribute this. So what are you doing and what are the challenges? And I just wanted to add one more thing about vaccines, if you could comment, because a lot of people think that when a vaccine happens, everybody will be cured. COVID will be gone forever. And this is not true. And why aren't we picking up the vaccines when the United Kingdom is picking it up? This is a big question everybody's asking. And you know full well that the government of Canada and public health cannot put a vaccine out there for Canadians to use, even though it's free, if it's not safe and if it's not effective. And those are the two big hurdles we are jumping through because we want to protect Canadians and we want to make sure that when they get a vaccine that it's going to be able to assist them in having some kind of very mild case of COVID-19. So I will let you pick up those questions.
Okay, this might be a bit of a longer answer. I'll try to condense it as much as possible, but it's a complicated topic, as you would know, because it's not on or off. And you're right. I think I'll start with where you left off, which is, actually part of your question, which is, or observation, which is, are vaccines going to mean that COVID-19 disappears? And I think, there's a simple answer to that. And the answer is no, but you can look at other diseases like polio, for example, is a good example. Measles is a good example. Mumps are a good example. There have been diseases in the past that have been just as threatening to societies. And some of them have brought, for example, influenza, tremendous amount of suffering and death every single year, actually, with influenza, not to the degree of COVID, but certainly a high degree of death, especially in older people related to influenza. And we know that some diseases like coronaviruses, like COVID-19, are actually really hard to sort of quote unquote kill. Like once it gets to this point where it is so endemic, that means it's everywhere in every country, it's high degree of circulation. It gets really hard to put it out, if you will. And so vaccines, though, are going to be such an important part in actually reducing the amount of spread and saving lives. That's what they're about. They're about saving lives of people who are going to die if they get COVID-19, and then reducing the spread to a manageable level so that if you can think about the flu every year, it's kind of like that, where, it's deadly for some people. It circulates through the population, but if enough people get vaccinated, it actually reduces the number of cases that healthcare systems have to work with. That's, I think, what scientists are more or less thinking is going to happen with COVID-19. So we have a couple challenges getting there. One, the vaccines are brand new, as you pointed out. The UK just approved the first vaccine that from a major manufacturer that is a credible manufacturer today. We don't think our decision will be very far behind. We have almost all of the data that we need from Pfizer. Each vaccine company provides, typically this takes over a year, by the way, to approve a vaccine. Typically what happens is vaccine companies or manufacturers of other pharmaceuticals They have to do all the clinical trials. That means testing it in people and making sure there's no side effects, and then submit everything at the end. And then Health Canada takes another year to review that. In this case, we've actually changed the way things are done, and we've sped it up by providing an opportunity for the companies to provide the information.
Now, we've got another question.
And reviewing the information as they get it to speed up access. But I want to really stress what you said, Hedy, which is that we will never compromise on the safety. And so when you hear politicians, particularly those across the aisle from us, saying, well, why doesn't the Prime Minister approve a vaccine? Why doesn't the Prime Minister approve a rapid test? What they're actually saying is, we should have politicians make these decisions. And I reject that. I think we should have the scientists, the researchers, the experts make the decisions after they've reviewed the data. So to your point, we can make sure they're safe for use in Canada. Now, a couple other questions I just want to hit on, because that was a big question. One of the questions was, when vaccines are available, how should we expect distribution to be allocated? In the first part of receiving vaccines, the two most promising vaccines that are closest to approval are kind of complicated vaccines. They require really cold storage. Also, by the way, the world is chomping at the bit to get them. So these manufacturers are making decisions based on number of people in your country, the disease activity, all kinds of things. And they're allotting certain doses to different countries. So Canada's going to get a small amount, 6 million doses of the two vaccines in the first few months of first few months of 2021. And then after some of the more usual suspects, if you will, vaccines that use more easily distributed sort of style of vaccine, once those become approved and become, start rolling off the sort of delivery line, if you will, or the manufacturing line, that's when we're going to start to see way more volume arrive. So I think for the first couple months, we're not going to have a lot, and that's why we have to prioritize. But after that, we're going to start to have a lot of vaccination available of different kinds. And the other thing that we don't know quite yet is which kinds work for which people, because sometimes not all vaccines work on all people. Yeah. So some might be for older people, some might be for, younger people. We don't really know yet about pregnant women, children. There's not been a lot of research on children. So that work will continue. And actually the vaccination is going to provide some of the details around immunity, because that was another part of that question, or one of the questions was, what about these immunity passports? It's a little bit fragile, that idea, because we don't really know yet. Is this immunity something that lasts forever, like measles and mumps? People say probably not, because it's a different kind of virus. Or is it something that lasts for a few months? Does it mean that you're still infectious or not? Probably not still infectious. Probably you are for sure protected from COVID-19, or at least the severe, but most people, don't forget, there's still some people that will be affected. So there's a lot of unknowns in terms of the immunity piece. And that's why I think immunity passports and that idea is a little fragile still at this point in time. We're going to have to be really thoughtful, I think, as a society, how we include or exclude people, but also how we stay focused on protecting the most vulnerable.
And we have about 7 producers of vaccine that we have actually done contracts with, so that once they roll out their stuff, we will get it. And so I understand you answering in the House every day, you're saying, we're looking at over 400 million possible doses of vaccine, because we don't know if it's just going to be one vaccine needed, or maybe a phased of one and then 2 another thing, because all of this is still up in the air, as you said. Everything is being done quickly instead of having the time to do the research while it's going on. So I think those are important things people need to know. And finally, I think the question is, once those vaccine comes out, you have a plan for distribution, because the vaccine has to be kept at a certain temperature. It is very low temperature. And I know that you have the armed forces, a general who's going to be in charge of all of that protocol, rollout, process, to make sure that it's done properly. Can you talk about that?
That was the meeting I was just in. I was talking and getting an update from my officials about what was happening on the distribution plan, working with provinces and territories. I think it was Vidhi or perhaps Anthony, that was talking about, I think it was Anthony that was talking
It was
about
Anthony who asked.
yeah, provinces and territories. We are working. I know that it doesn't always seem this way because, of course, politics is politics, but at the officials level, at the healthcare level, things are going very smoothly in terms of vaccine distribution. In fact, they're planning and practicing how to distribute, in particular, these really complicated vaccines. And they're planning for all kinds of things to go wrong because undoubtedly things could go wrong. Think about, we live in a northern climate. There could be an accident with one of the trucks that's delivering vaccines. There could be a problem with one of the batches of doses. And so we're planning for all of those problems.
Eventualities, yeah.
That's exactly it. And, that's a really important piece of actually success. And so that work continues with provinces and territories. Tomorrow, and I'll give your viewers a sneak peek, there's going to be an actual technical briefing for media on the plan of distribution. So there'll be a lot more information in the news tomorrow about what's happening and how the provinces and territories are interacting and how those priority populations will be chosen, hopefully, by the provinces and territories. Just to be clear, I know Shaena was talking about who it will be allocated to. The federal government gives some very broad recommendations, but then the provinces and territories who actually deliver healthcare, they refine those decisions, and they're the ones that will decide at the end of the day who will be first in line and who needs to be prioritized. But I can tell you this, I'm pretty sure they have their focus on the same exact goal, which is to save lives and stop spread.
Yeah. Well, that's great. Thank you, because I know that people are confused about vaccines, and you gave us a really good sense of understanding how it works, what it's going to do, what it could do, and how much we still don't know about what the results are going to be. So I think it's interesting. People can get that information. They can think about it. And of course, everybody knows that if you want to get any further information, you can contact our office and we will let you know whatever is going on. But because the media is getting a briefing, you should all tune in to watch what the media has to say, because the media so far has been making statements without actually understanding. Now they're going to get the technical understanding, and then you can get the facts from them once they get that briefing.